right, so let's get into some of the details, some of the frequently asked questions with the breast augmentation. The first thing that we're going to ask you is what your breast size is and what you want to be. Now, cup sizes are not exact, so we just want an idea of where you're starting and where you're going to, because that gives us an idea of whether we're looking at a small implant, medium size implant, larger size implant. So we just want to get a feel for that. We also want to know your pregnancy history, because that's going to change a little bit of how we're going to treat your breast, maybe what implant, maybe what style we're going to use, all that kind of stuff. Additionally, we're going to want to know if you breastfed in the past, how long it's been, to make sure that it's safe to undergo a breast augmentation procedure. Then we also want to know your past medical history, if you have any problems that may affect your procedure, any previous surgeries, maybe you've already had a breast augmentation. Then we're going to ask you some questions about what implant you currently have in, where they're placed, what incision was made, what type of implants they are. We want to know all those kind of things and what problems you're having. Also, we want to know if you've had any surgeries in the past that may affect your breast augmentation, or if you've had any problems or issues from those surgeries in the past, because those are the things that we want to know, such as, did you have problems waking up from anesthesia? Did you have problems with nausea and vomiting after anesthesia? We want to know all those things so that we can make this the best, safest procedure for you. The next thing that we're going to talk about is implant selection, incision selection, and placement selection. So we use about 3 different incisions, but we usually use one most common incision. So the 3 incisions that we can use are underneath the breast, around the nipple areola complex, or in the axilla. Now, 99% of my patients probably go through the under the breast incision. And the reason why we do this is because it gives me the best access to your breast to make sure that everything is going to sit well, and it also has the least complications for infection or capsular contracture because it's cleaner than going around the nipple. I don't really like going through the axilla, even though that can be clean, just because I don't have really good control of the pocket. Very few people can actually do a revision procedure through the axilla. And so if you're getting a breast augmentation now and you're under the age of, say, 50, chances are you're probably going to have another breast surgery in the future, because these are devices that don't last forever. Most people are going to need to get them switched out at some point. And so in order to get them switched out, you're probably going to need that incision underneath the breast anyway, which we can use again in the future. So why have 2 incisions whenever you can just have 1? So after we talk about the incision, we're going to talk about whether you want saline or silicone. Most of our patients, again, probably 99%, wind up going with silicone. It looks and feels a little bit more natural. You don't have to worry about getting a deflated or a flat tire if one were to rupture. The newer generation silicone is the gummy bear silicone. Almost all of our implants that we have are that gummy bear silicone. And so even if it does rupture, that silicone is going to stay in place. That being said, if you do have a ruptured implant, you should get it changed out, and there are multiple different ways of monitoring your implant to see if it does rupture over time. That being said, if it does rupture, it's not as much of an emergency to get them taken out because you don't have one deflated and one up. The next thing that we're going to talk about is above the muscle or below the muscle. And so this is something that's a little bit more tailored to my patients, and I'm going to explain some of the reasons why we may do one or the other. So if you have basically no breast tissue, if you have very little coverage that's going to cover that implant, probably going to have to go below the muscle. That being said, I do have some of my patients who are workout fanatics or bodybuilders or something like that, somebody who's going to be having to activate their pec muscles very often, that we are going to put above the muscle even if they have a little bit of breast tissue, and we're going to just use a more cohesive implant to hide some of that rippling effect. But if you can put it below the muscle and you have less breast tissue to cover that implant, probably best to go underneath the muscle. It's going to just look and sit more natural. It's going to give you more coverage of that implant. Now, for some of my patients who have a little bit of breast drooping or ptosis, we're going to talk about either doing an aggressive dual plane, meaning that we put it underneath the muscle but release that muscle so that your implant is sitting more with your breast tissue, or just putting it above the muscle so that the implant sits completely with the breast tissue. And the reason why we do this is because we don't want that muscle to act like an internal bra and keep that implant nice and high, and then your breast tissue fall off the front kind of like a waterfall or a Snoopy. And so those are the reasons why we place the implants either below the muscle or above the muscle, and I'm going to be talking to you about which one's the best for you. Okay, so after we kind of talk about things, we are going to get you to change into a gown. I'm going to come back in, take some measurements of your breast. Now that is going to determine where we're going to go as far as implant sizes, profiles, all those kind of things, and see if you may need a lift or some other kind of tweak of your breast. Then we're going to move into putting you into a bra and trying on some breast implants and some sizers. So if you notice on the left side of the table, we have sizers, which are these. These are not breast implants. We get that question all the time. These are just kind of sizers to get an idea of what look you're wanting to go for. Then we'll slip in the actual implants themselves, and we'll put those in the bra to kind of determine the profiles, sizes, all those kind of things, to really hone in on exactly what implant we're going to use, if not a range of what implants we're going to use. As we get an idea of what your base diameter, or that measurement that I take right here, is, and then what size we're going for, we're going to start talking about some profiles. So I have some great videos talking about different profiles, about upper pole fullness, all those kind of things. And if you scroll down in the videos below, you'll be able to find those. So if you're interested in learning more about that, go ahead and click on those videos.